sitting on your couch, perfectly calm. Your heart rate is a steady 70 beats per minute. You stand up to walk to the kitchen, and within 10 seconds, your chest is pounding. Your watch screams that you've hit 130 beats per minute. That is equivalent to sprinting on a treadmill, but you haven't moved 10 feet. The room starts to swim. Your vision tunnels into a dark vignette, and you have to grab the countertop just to keep from hitting the floor. If you've gone to a doctor for this, you've likely heard the standard dismissal. It's just stress. You're having a panic attack. Take some deep breaths. Let me be very clear right now. It is not anxiety. It is a mechanical failure of your body's hydraulic system. What you are experiencing isn't an emotional reaction. It is a physiological battle against gravity, and your body is currently losing. When a healthy person stands up, their blood vessels automatically tighten to push blood up to the brain. But in your case, that signal is getting lost. Your blood is pooling in your legs and abdomen. It is starving your brain of oxygen. Your heart isn't racing because you are nervous. It is racing because it is frantically trying to pump blood uphill against a collapsed system just to keep you conscious. This is a glitch in the human OS. It is known as dysautonomia, or more specifically, POTS, Postural Orthostatic Tachycardia syndrome. And for years, patients have been gaslighted into believing it's all in their heads while their biology is screaming for help. In this video, we are going to look under the hood of your autonomic nervous system. I'm going to show you exactly why your internal thermostat is broken. I'm going to give you the specific clinical protocols beyond just drinking more water. We are going to force your blood vessels to respond correctly again. But first, we have to dismantle a dangerous piece of advice, one you've likely been following. There is a common heart-healthy recommendation that 99% of doctors give, but for your specific physiology, it is actually accelerating your heart rate and making your symptoms significantly worse. You go to the cardiologist. You wear the Holter monitor for 48 hours. You do the stress test, running until your lungs burn. And then the call comes in. The nurse says, "Good news! Everything looks structurally normal. Your heart is fine." But you don't feel fine. You feel like you are dying every time you fold laundry. So, in the absence of a structural defect, the medical system defaults to the two most damaging labels in the history of chronic illness. It's just anxiety. You are deconditioned. The standard advice follows immediately. You just need to get moving, start jogging, push through the discomfort. I need you to understand this. For a POTS patient, this advice is dangerous. It is functionally the same as telling someone with a broken leg to run it off, to strengthen the bone. Here is the trap you are caught in. You trust the doctor, so you try to exercise. You get on the treadmill. Within 90 seconds, your heart rate hits 180 beats per minute. You feel nauseous, your vision blurs, and you have to lay down on the gym floor to keep from passing out. The doctor looks at this failure and says, "See, you're out of shape. A healthy person could run for 20 minutes. You couldn't last 2. This creates a feedback loop of shame and a physiological loop of deterioration. You stop moving because moving feels dangerous, because for you, it is dangerous. This inactivity does eventually lead to deconditioning, which makes the symptoms worse, confirming the doctor's bias. But make no mistake, deconditioning is the result, not the cause. You didn't get sick because you stopped moving. You stopped moving because your human OS crashed. The enemy isn't laziness. The enemy is gravity. We live on a planet that is constantly pulling your blood down into your feet. Standing up is actually a massive hemodynamic challenge. When a healthy person stands up, a complex reflex arc kicks in. Within milliseconds, pressure sensors in your neck detect a slight drop in blood pressure. They instantly fire a signal to the brainstem. The brainstem fires a command to clamp down the blood vessels in your legs. This squeezes the blood back up to the head. It is seamless. You don't even feel it happen. But for you, this communication line has been cut. This is the definition of dysautonomia. When you stand, gravity wins because your vessels fail to constrict. A massive volume of blood, 500 to 800 milliliters, roughly the size of a large water bottle, instantly drops out of effective circulation. This brings us to the most important realization. Your heart is not the problem. Your heart is actually acting heroically. When that blood pools in your feet, your brain isn't getting oxygen. Your heart senses this emergency and starts beating 140, 150, 160 times a minute. It is not racing because it is sick. It is racing because it is frantically trying to pump a half-empty tank to keep you conscious. Telling a POTS patient to just jog is ignoring that their body lacks stability. You cannot exercise your way out of a circulatory collapse if you don't fix the plumbing first. And the damage is limited to the heart. Because blood is pooling in your gut, your digestion slows to a halt. Because blood isn't reaching your brain, your cognitive function drops. Because your heart is running a marathon while you stand still, you experience profound exhaustion. The medical system treats these as separate specialists: a cardiologist, a gastroenterologist, a psychiatrist, but they are all the same problem: a failure to fight gravity. So, why is this happening? Why did your vessels stop listening to your brain? The answer lies in a specific chemical imbalance, one that almost no standard blood test looks for. We're going to expose that mechanism in the next chapter. Before we open up the hood of the nervous system, I need to ask a serious question. How many of you have sat in a doctor's office, described your racing heart and dizziness, and were handed a prescription for antidepressants? How many of you were told you're just stressed? If that is your story, I want you to comment "misdiagnosed" down below. It is time we visualize just how massive this blind spot in modern medicine really is. Now, let's look at the machinery. To understand why you feel crazy, you have to understand the autonomic nervous system. Think of the ANS as the background operating system. It is the code that runs 24/7 without you ever touching a keyboard. You don't tell your kidneys to filter toxins, you don't tell your pupils to dilate, and you don't tell your heart to beat. The ANS handles it. This system has two primary modes, acting like a seesaw. The sympathetic nervous system. This is the fight or flight mode. It is the gas pedal. It prepares you to run from a tiger. The parasympathetic nervous system. This is the rest and digest mode. It is the brake pedal. It calms you down and repairs the body. In a healthy human OS, these two switch back and forth fluidly. When you stand up, the gas pedal is pressed just a little bit, only about 10% to tighten your veins. When you sit down, the brake kicks in. But in a POTS body, the seesaw has snapped. The brake line is cut, and the gas pedal is matted to the floor. Here is the specific mechanism, the aha moment, that explains why you feel terrified even when you're watching a comedy movie. It is called the Catecholamine Dump. Remember what we established in Chapter 2. When you stand, gravity pulls your blood down, and because your vessels don't squeeze, the blood stays there. Your brain, sitting at the top of the tower, suddenly realizes it is losing oxygen pressure. The primitive part of your brain does not understand POTS. It only understands survival. It interprets this sudden drop as a catastrophic hemorrhage. It thinks you are bleeding to death. To save your life, the brain slams the emergency button. It signals the adrenal glands to release a massive surge of norepinephrine, adrenaline. Norepinephrine is a powerful chemical messenger. The brain is using it as a last-ditch effort to chemically force your loose vessels to constrict and shove blood back up to the head. But norepinephrine is also the fear molecule. It is the exact same chemical released when you are held at gunpoint. When this chemical hits your bloodstream, it triggers a cascade of physical sensations. Your hands get cold and clammy. You start trembling. Your heart pounds against your ribs. You feel a distinct, overwhelming sense of impending doom. So, picture the scene. You're standing in line at the grocery store. Physically, you're safe. But physiologically, your blood has dropped. Your brain has panicked, and it has just dumped a gallon of fear chemicals into your veins just to keep you conscious. You feel anxious. You feel panic. But, and this is critical, it is not psychiatric anxiety. In psychiatric anxiety, the fear starts in the mind. In POTS, the failure starts in the body and chemically hijacks the mind. This is often called hyperadrenergic POTS. This distinction changes everything. If you treat this with deep breathing or talk therapy, you will fail. You cannot breathe your way out of a gravity problem. No amount of mindfulness will tighten a paralyzed vein. However, if we treat this as a hydraulic engineering problem, if we can mechanically pressurize the system before the brain panics, we can prevent the adrenaline dump from ever happening. We don't need to calm the mind. We need to pressurize the pipes. The problem is that the standard lifestyle advice, scientifically, is illiterate. You've been told to drink more water. I am going to say this as clearly as possible. For a POTS patient, plain water is dead weight. In fact, drinking plain water without the right chemical drivers might be flushing out the very electrolytes you need, actually lowering your blood volume. To hack this system, we need to look at osmolality. We need to talk about salt, but not the low sodium advice the government gives. We're going to look at a protocol that uses sodium as a medical drug to expand your blood volume by force. In the next chapter, we're going to dive into the deep mechanisms and the specific physics of compression gear that actually works. We are about to cover the specific protocols that turn the biology we just discussed into a treatment plan. But managing POTS is a multi-front war. In our next video, we are going to break down the POTS sleep paradox, why you wake up exhausted even after 10 hours of sleep, and how to fix your circadian rhythm. If you want that guide delivered to your feed, hit that subscribe button and the bell right now. You cannot heal if you cannot sleep. Now let's engineer the solution. We have identified the problem, a lack of blood flow to the brain, caused by gravity and a malfunctioning autonomic system. To fix this, we need to activate two specific biological pathways. We're going to ignore the generic health tips and focus on the hemodynamic levers that actually move the needle. Pathway 1, the volume hack. Why salt is your drug. If you go to a general practitioner, they will likely tell you to watch your sodium intake. Salt raises blood pressure, they say. Salt causes heart disease. For the general population, this is debatable, but for the POTS patient, sodium is not a seasoning. It is a pharmaceutical intervention. Here is the data. Research indicates that many POTS patients are hypovolemic. This means you're walking around with a blood volume that is 15 to 20% lower than a healthy person. Imagine a car engine designed for 5 quarts of oil, trying to run on 3. It will overheat, it will grind, and it will eventually seize. That is your body. When you drink plain water to hydrate, it enters your bloodstream. But because you don't have enough sodium to hold it there, your kidneys immediately filter it out. You pee it away within the hour. You're running water through a sieve. The mechanism, osmotic pressure. To keep fluid inside your veins, to actually expand the size of your blood tank, you need osmotic pressure. Sodium acts like a magnet for water. When you consume high levels of sodium, and we're talking clinical doses here, often 3,000 to 10,000 milligrams per day, that sodium sits in your blood vessels. It aggressively pulls water out of your tissues and holds it in the vascular space. Without salt, water enters, kidneys filter, urination. Blood volume stays low. With salt, water enters, salt binds it, blood volume expands. This increased volume physically stretches the walls of your veins. This internal pressure helps fight gravity. It's hydraulic engineering. When the pipes are full, the pump, your heart, doesn't have to work as hard. The heart rate drops because the stroke volume increases. Pathway 2, the external muscle. Why your socks are failing. The second lever is mechanical counterpressure. Almost every POTS patient is told to buy compression socks. You go to the pharmacy, buy a pair of knee highs, and notice absolutely zero difference. You conclude that compression doesn't work. Compression works. You're just compressing the wrong area. Let's look at the physics. Gravity pulls blood to the lowest point, yes, but the largest reservoir for pooling blood is not your calves. It is your splanchnic bed, the abdomen. The blood vessels surrounding your stomach, intestines, and liver are incredibly elastic. They can hold a massive amount of fluid. A statistic that's shocking: when you stand up to 25 to 30% of your total blood volume can shift into this abdominal area. Wearing knee highs is like trying to stop a flood by putting a sandbag on the second floor. The water is pooling in the basement, the gut, and the socks are doing nothing to stop it. The fighter pilot protocol. We need to treat you like a fighter pilot. When pilots pull high G-forces, blood drains from their brains and they pass out. To prevent this, they wear anti-G suits. These suits don't just squeeze the calves, they squeeze the thighs and the abdomen. For a POTS patient, clinical studies show that abdominal compression, a binder or high-waisted compression tights, is significantly more effective than calf compression. Knee highs, minimal effect. Abdominal compression can reduce standing heart rate by 10 to 15 beats per minute, instantly. Why? Because you're mechanically acting as the vasoconstriction that your nervous system is failing to provide. You're physically squeezing the splanchnic bed, forcing that blood out of the gut and up to the heart. You're essentially wearing an external exoskeleton for your blood vessels. So, the deep dive mechanism is this. You must chemically expand the blood volume with sodium, and you must mechanically force that volume upward with abdominal compression. In the next chapter, we are going to convert this science into a literal step-by-step daily schedule. I'm going to tell you exactly when to take the salt, how to put on the gear, and the feet-on-floor rule that saves your morning. We have covered the theory. We know gravity is the enemy, sodium is the fuel, and compression is the armor. Now, we are going to integrate these into a rigid operational protocol. This is not a lifestyle suggestion. This is a launch sequence. If you were launching a rocket, you wouldn't just hit start and hope for the best. You would go through a checklist to ensure all systems are pressurized. You need to treat your mornings the exact same way. Here is the Human OS Daily Protocol for POTS management. Step 1. The Hydromic Prime. 7 a.m. The most dangerous moment of your day is the first 60 seconds after you wake up. You have been lying flat for 8 hours. Your kidneys have filtered out fluids while you slept. Your blood volume is at its absolute lowest point. If you hear your alarm, jump out of bed and run to the bathroom, you are asking for a syncope episode because you are standing up with an empty tank. The protocol. Prepare a salt elixir the night before. Place 500 milliliters of water and your electrolyte packet on your nightstand. When you wake up, do not stand up. Sit up slightly in bed or stay lying down and drink the entire 500 milliliters. Wait 15 minutes. Why? You are mechanically pressurizing the system before you introduce the variable of gravity. You are giving that sodium time to hit your bloodstream and start pulling fluid into your veins. You don't launch the rocket until the fuel lines are full. Step 2. The exoskeleton suit up. 7:20 a.m. Before you leave your bedroom, you put on your compression gear. Remember the lesson from Chapter 4. Waist high is non-negotiable. If you put your tights on after you've been walking around, it's too late. The blood has already pooled. You are trying to squeeze toothpaste back into the tube. You need to apply the external pressure while the blood is still evenly distributed, when you are horizontal. Step 3. The zero gravity training. The exercise fix. Now let's address the deconditioning myth. Your doctor was right that you need to exercise, but they were wrong about how. If you try to jog, your heart rate spikes because of gravity, not exertion. You aren't training your heart, you are traumatizing your nervous system. To fix this, we need to remove gravity from the equation. The protocol: you need recumbent exercise, rowing machine, recumbent bike, swimming. When you are horizontal, gravity is neutralized. Your blood doesn't pool in your legs, it flows easily back to the heart. This means your heart can fill completely before it pumps. This allows you to actually strengthen the cardiac muscle without triggering the adrenaline dump. The progression: start with 10 minutes a day. Your goal is a Zone 2 steady state, challenging but not panicked. In months, as your blood volume expands, you can slowly transition to upright exercise, but you have to earn the right to stand. Step 4. The carbohydrate coma evasion. Finally, let's talk about why you feel like passing out after lunch. Digestion requires blood, a lot of it. When you eat a massive meal, especially one high in simple carbs like pasta, your body diverts a huge amount of blood to the gut. In a healthy person, the legs tighten to compensate. In a POTS body, they don't. So the blood leaves your brain and goes to your stomach. This is called Post-Prandial hypotension. Furthermore, high-carb meals spike your insulin, which can worsen the crash. The protocol: small, frequent meals. Do not eat 3 giant meals. Eat 5 small ones. This reduces the blood demand on your gut. Low glycemic index. Focus on proteins and healthy fats. Avoid the sugar spike, the salty snack. If you feel a crash coming on, don't reach for sugar. Reach for broth or a pickle juice shot. You need pressure, not glucose. This protocol: hydrate horizontally, compress the core, train flat, and eat small, is the manual for operating a machine with broken gravity sensors. It requires discipline, but it is the only way to rewrite the code. Let's recap the operational manual for your new human OS. The diagnosis: you are not anxious, and you are not crazy. You are fighting a hydraulic war against gravity, and your autonomic nervous system is losing the signal. Your heart is racing because it is trying to save you, not hurt you. 2. The mechanism: the enemy is blood pooling in the legs and the gut. This drops oxygen to the brain, triggering a fight-or-flight adrenaline dump that mimics panic. 3. The protocol: the prime. Don't stand up until you have pressurized your system with salt and fluids. The armor. Forget the knee highs. You need abdominal compression to squeeze the blood out of your gut. The training. You must exercise, but you must do it horizontally. Recumbent bike, rowing, to remove gravity from the equation until you are strong enough to stand. This is a condition that requires you to be the CEO of your own physiology. The medical system is slow to catch up, so you must be the expert in the room. Session time. Now, if you follow this protocol perfectly, you will fix your day. But there's another battleground we haven't touched: the night. Most POTS patients suffer from painsomnia. You are exhausted all day, but the moment you lay down, your heart pounds and you can't sleep. This is because laying down causes a massive fluid shift that confuses your kidneys and your adrenaline system. I have broken down exactly how to fix this. Your nocturnal adrenaline dumps. In this video right here, the POTS sleep paradox. Click that video now. It is the missing half of this puzzle. You cannot heal the body if the mind never sleeps. I'll see you there. Class dismissed.